Did you know that some signs and symptoms of HIV in men are different from those in women after they get infected? Human immunodeficiency virus, or simply HIV, is an infection that affects millions of people worldwide, regardless of gender and age. However, it's important to recognize that symptoms can manifest differently in men and women after infection. While some symptoms are similar, there are notable differences that can affect how HIV is diagnosed and treated in men. In this video, we'll discover the 7 signs of HIV infection in men, and discuss how to identify these symptoms early. Headache and fatigue. Persistent headache and extreme fatigue are often considered as one of the first signs after being infected with the HIV virus. These symptoms can be easily ignored or attributed to other causes, such as stress or lack of sleep. When the virus enters our body, its intention is to destroy the immune system, and in response to this attack, the body expends a lot of energy trying to expel the virus. Headaches associated with HIV can range from mild to intense, even when taking medications like painkillers. Fatigue can be extreme and interfere with daily activities, leading to constant tiredness even after prolonged periods of rest. These symptoms can persist for weeks, or even months, becoming an important warning sign to seek medical evaluation. Fever for a few days. Fever is a common response of the immune system to an infection. In men with HIV, fever may occur as a result of the body's response to the virus, or opportunistic infections that develop when the immune system is compromised. HIV-associated fever is usually persistent, and can last for several days. It can occur intermittently, or continuously, and may be accompanied by other symptoms, such as night sweats and chills. It's important to note that not all men with HIV will experience fever, and the absence of fever does not rule out the possibility of virus infection. However, if a man experiences persistent fever without an obvious cause, it is essential to seek medical guidance and undergo an HIV test. If the video is being useful to you, subscribe to the channel, activate the notification bell and click on like. Joint and muscle pain. Joint and muscle pain is another common symptom of HIV infection in men. This pain can range from mild to severe, and can affect any part of the body. It can be mistaken for normal muscle aches, especially after intense physical exercise. However, when joint and muscle pain persists for weeks or months, it's important to consider the possibility of HIV. These symptoms can be caused by the virus itself, opportunistic infections, or the body's inflammatory response to the infection. Joint and muscle pain can interfere with a man's quality of life, affecting his ability to move and perform daily activities. Skin rashes. Skin rashes are usually signs that something is wrong in the body. In men with HIV, skin rashes can occur anywhere on the body, and range from small red patches to more severe lesions. These skin rashes can be itchy, are painful and may be associated with other symptoms such as fever and fatigue. HIV-related skin rashes can be caused by the virus itself, opportunistic infections, or reactions to medications used in HIV treatment. If an unexplained skin rash persists for an extended period, it's important to seek medical evaluation to determine the underlying cause and receive appropriate treatment. Dry cough. A persistent, dry cough can be a sign of HIV infection in men. This cough can be irritating and uncomfortable, especially when it occurs without other cold or flu symptoms. Cough associated with HIV can be caused by opportunistic respiratory infections such as pneumonia, caused by Pneumocystis jirovecii, or lung inflammation due to the body's response to the virus. It's important to note that dry cough can also be caused by other conditions such as allergies or environmental irritants. Vomiting and diarrhea. Persistent vomiting and diarrhea can be signs of HIV infection in men. These symptoms can be caused by the virus itself, opportunistic infections, or side effects of medications used in HIV treatment. Diarrhea associated with HIV can be severe and prolonged, leading to dehydration and weight loss. Vomiting and diarrhea may be accompanied by other symptoms such as abdominal pain, fever, and loss of appetite. If these symptoms persist for more than a few days, it's important to seek medical evaluation and undergo an HIV test to determine the underlying cause and receive appropriate treatment. Night sweats. Excessive night sweats, especially when there are no other obvious reasons for them, can be a sign of HIV infection in men. Night sweats associated with HIV can be intense and can result in wet clothes and sheets. This symptom can interfere with sleep and a man's quality of life, leading to fatigue and tiredness during the day. Night sweats can be caused by the virus itself, the body's inflammatory response to infection, or opportunistic infections. If night sweats persist for several weeks without improvement, it's important to undergo an HIV test and seek medical guidance to determine the underlying cause and receive appropriate treatment. Early detection of HIV is important to ensure effective treatment and a healthy life. Men should be aware of the common signs and symptoms of HIV infection and seek medical guidance if they experience any of these symptoms. Regular HIV testing is important, especially for those engaging in risky behaviors such as unprotected sex or needle sharing. Additionally, it's essential to remember that not all people infected with HIV will experience symptoms. Many people live with HIV without knowing it, highlighting the importance of regular testing. I hope you liked it and click on the like button, subscribe to the channel, turn on the notification bell, and don't forget to share the video with your friends and family.